Hi all, welcome to Physio Exam Buddy. This video is on the ovarian changes happening in the menstrual cycle. What is the definition of this menstrual cycle? It is the monthly rhythmical changes in the hormonal secretion along with the corresponding physical changes occur in the ovary and other sexual organs. So not only the physical changes occurring in the reproductive organs, but also the changes in the hormonal secretion also happens during the menstrual cycle. And the periodic vaginal bleeding with the shedding of the uterine mucosa, it is known as the menstruation. Regarding the duration of the menstrual cycle, the menstrual cycle averages 28 days, but it can be as short as 20 days or can be as long as 45 days. And one menstrual cycle means from the start of the one menstrual period to the start of the next. So the days of the menstrual cycle is usually identified by the number, that is first day of menstruation, that is the onset of bleeding in a female of reproductive age group, that is the first day of menstruation. It is considered as the day one of the menstrual cycle. So day one of the menstrual cycle to the start of the next, it includes one menstrual cycle and it averages around 28 days, but it can be range from 20 to 45 days. Menstrual cycle can be classified as ovarian cycle, which include the changes in the ovary. Uterine cycle means the changes happening in the uterus. Cervical cycle, that is changes in the cervix, and the vaginal changes in the vaginal cycle, as well as certain breast changes are also occurring during the menstrual cycle. This video is on the ovarian changes. We will see what are the changes occurring to the ovary in the menstrual cycle. The changes in the ovary can be classified into three phases, that is follicular phase, ovulation and the luteal phase. First, about the follicular phase. At puberty in a female, almost 3 lakh primordial follicles will be present. What is this primordial follicle? We have studied in the video of oogenesis, which was posted earlier, that the ovum surrounded by a single layer of granulosa cells. It is known as the primordial follicle. In follicular phase, what happens is the primordial follicle is converted into primary follicle and the primary follicle is converted into Graafian follicle. The follicular phases can be again divided into two. First one is the proliferative phase followed by the antral phase. Proliferative phase. This happens in the first few days of the each monthly cycle or the menstrual cycle. During the first few days, there will be an increase in the FSH as well as LH secretion, and out of this FSH secretion will be more when compared to that of the LH. So, whenever there is an increase in the follicle stimulating hormone, the primordial follicle which is present in the puberty, which is surrounded by a single layer of granulosa cells, it will get converted into primary follicle in the proliferative phase. And by the action of the FSH, there will be accelerated growth of around 6 to 12 primary follicles each month. So the conversion of primordial follicle to primary follicle, that is the proliferative phase, and it happens because of the effect of the hormone FSH. Regarding the structure of the primary follicle, we have studied that the primordial follicle, it is surrounded by only a single layer of granulosa cells. But in primary follicle, there will be rapid proliferation of the granulosa cells around the oocyte, forming additional layers. And the oocyte will get surrounded by a layer of mucopolysaccharide, which is shown as black color in this picture. And this layer, it is known as the zona pellucida. And outside this granulosa cells, there are second mass of cells which is known as the theca cells. And the theca cells are of two types. The external layer, it is known as the theca externa, and it is a highly vascular connective tissue capsule. Whereas next to theca externa is the theca interna, and this will secrete the hormone estrogen and progesterone from the primary follicle. Next is the antral phase. In antral phase, the mass of the granulosa cells surrounding the ovum will begin to secrete a fluid which is known as follicular fluid, and it will be rich in estrogen. So, because of the increase in the secretion of the fluid, it leads to a formation of a cavity within the granulosa cell mass, and that cavity it is known as the antrum or antral cavity. Correspondingly, there will be an increase in the size of the diameter of the ovum too. This is the follicular cavity in this picture, surrounded by the granulosa cells, and this is the ovaries. One follicle in one ovary will starts to grow rapidly by the day 6. So during the proliferative phase, around 4 to 6 follicles will get mature. Even though these 4 to 6 follicles get mature, only one follicle in one ovary will start to outgrow the others by day 6, and they form a dominant, also known as mature or Graafian follicles. Whereas the remaining follicles which is formed or which get proliferated in the proliferative phase will become atretic follicles by apoptosis. And only one Graafian follicle will be formed in each cycle. This will prevent more than one child development in each pregnancy. Next, about the Graafian follicle. So in the antral phase, the granulosa cells will secrete the fluid, results in the formation of a cavity which is known as the antral cavity, and this results in the formation of the Graafian follicle. Next, about the structure of the Graafian follicle, you can see here that the ovum, it occupies an eccentric position, and it is surrounded by 2 to 3 layers of the granulosa cells, which is known as the cumulus euphoricus. Whereas the cells with which it is attached to the wall of the follicle, it is known as the discus proligerus. And the follicular growth in the proliferative phase, it is stimulated by the hormone FSH alone. Whereas in the antral phase, estrogen will come in the follicle, and this will increase the number of the FSH receptors in the granulosa cells by positive feedback mechanism. So there will be an increase in the action of the FSH because of the increase in the number of FSH receptors. Also, there will be more and more estrogen secreted by the granulosa cells. So FSH together with the estrogen will increase the number of LH receptors also on the granulosa cells, which will increase the follicular secretion. So there will be an increase in the estrogen, increase in the LH, which finally results in the proliferation of T-cell cells, as well as there will be increase in the secretion. That finishes the follicular phase. It is followed by the ovulation, and this occurs on day 14 in a normal 28-day cycle. What is this ovulation means? It is the release of the secondary oocyte from the ovary. So the Graafian follicle will become filled with the fluid secreted by the granulosa cells, and once it reaches a limit, the Graafian follicle will get ruptured and the ovum will be extruded out into the peritoneal cavity. And this ovum which is extruded out will be picked up by the fimbriated ends of the fallopian tubes because it is near to the ovary, and it is then transported to the fallopian tube into the uterus. And for the ovulation, that is rupture of this Graafian follicle, it needs a special phenomenon which is known as the LH surge. Only if the LH surge is there, then there will be ovulation. What is this LH surge? So this is the monthly 28-day cycle. So day 14 ovulation occurs 2 days prior to the ovulation. There you can see here, this is the rate of LH secretion. There occurs an increase in the rate of secretion of the LH around 6 to 10 folds 2 days prior to the ovulation. That is known as the LH surge, and it peaks at 16 hours before ovulation. And this is one of the essential phenomena which is a prerequisite for the ovulation to happen. Whenever there is an increase in the FSH during the follicular phase, the FSH plus LH will cause a rapid swelling of the follicle few days before ovulation. LH also acts on the granulosa and the theca cells, and it will convert these cells into progesterone secreting cells. So there will be a decrease in the rate of secretion of the estrogen from the granulosa and theca cells. Instead, they become progesterone secreting cells, thereby increasing the progesterone level. So the rapid growth of the follicle in this phase, followed by decrease in the estrogen and initiation of the progesterone secretion. All these three things will result in the expulsion of the secondary oocyte from the Graafian follicle, resulting in the ovulation. And this ovum will be picked up by the fimbriated end of the fallopian tube. So, luteinizing hormone usually causes an increase in the secretion of the progesterone, and the progesterone has certain effects on the Graafian follicle. That is, it will increase the secretion of the proteolytic enzymes, especially collagenase, which will weaken the wall of the Graafian follicle, resulting in the degeneration of the stigma and finally leading to follicular rupture. And another action of the progesterone is that it can cause Graafian follicle hyperemia as well as prostaglandin secretion from the Graafian follicle, which will increase the plasma transudation into the follicle, resulting in the follicular swelling as well as finally ending up in the follicle rupture. And finally, the ovum will be expelled out. Once the ovum is expelled, then the next phase, that is after ovulation, it is the luteal phase. The ruptured follicle, we know that in the cortex of the ovary, you can see follicles at different phases of the development. The one which ruptured will get filled with blood, and it is converted into a new thing which is known as the corpus haemorrhagicum. And minor bleeding from this follicle into the abdominal cavity will also occur, resulting in the peritoneal irritation as well as fleeting type of lower abdominal pain, which is known as Mittelschmerz. It is a sign of ovulation in females. And in the luteal phase, the granulosa and theca cells will again proliferate, and in the presence of luteinizing hormone, the clotted blood in the corpus haemorrhagicum will be replaced by the luteal cells. And this process, it is known as the luteinization, and finally resulting in the conversion of the corpus haemorrhagicum into corpus luteum. And the corpus luteum will begin to secrete the hormones estrogen, progesterone, as well as inhibin. And the formed corpus luteum has two phases, depends upon whether the fertilization will occur or not. If pregnancy occurs, there will be no more periods until delivery. But if there is no pregnancy, means the corpus luteum will start to degenerate by day 24. That is 4 days before the next menstrual cycle. And the corpus luteum is converted into a scar tissue, which is known as the corpus albicans. So this is the developing corpus luteum, and finally the scar tissue, that is the corpus albicans, if there is no fertilization. So by day 24, what happens is that normally the FSH and LH secretion results in the formation of the Graafian follicle as well as the corpus luteum, and the corpus luteum will begin to secrete estrogen, progesterone and inhibin. But by day 24, this corpus luteum will be converted into corpus albicans. So there won't be any secretion of the estrogen and progesterone as well as inhibin. Normally, when there is an increase in the estrogen, progesterone and inhibin, it will cause a negative feedback inhibition of the FSH and LH from the pituitary. But by day 24, because of the regression of the corpus luteum and its conversion into corpus albicans, there will be cessation of the estrogen, progesterone and inhibin. So the negative feedback effect on the FSH and LH will be absent. So what happens if the negative feedback effect is not on the FSH and LH? The FSH and LH secretion will begin to increase. So the increase in the FSH and LH secretion increases because of the removal of the negative feedback effect will result in the growth of the new cycle and resulting in the new ovarian cycle to start. And the same cyclical changes starting from the follicular phase, ovulation and luteal phase again continues. Thank you for your patient listening and keep on watching Physio Exam Buddy, which makes your physiology exams more easier.